Hi, my name is Stephanie Vorostek. I'm the program manager at CCPR. I'm here today with Dr. Ahab Halowish. He is our newest member of the CCPR surgical team, and I wanted to just sit down with him and have a conversation just so everybody could kind of get to know him, and that way when you come into clinic and you see his face, it won't be a surprise.
Thanks, Stephanie.
So Ahab, tell me a little bit about yourself.
So I was born in the United Kingdom and grew up in Egypt. And when I was a teenager, I moved to South Dakota, and I did my undergraduate studies in South Dakota. And I moved to Ohio, to Cleveland, to attend medical school. And when I was in Cleveland, that's when I was drawn to pediatric surgery. I really thought there was a very unique field where you can truly change the lives of not only the patients but their whole family. And it takes about 9 years of training to become a pediatric surgeon. So after my time in Cleveland, I moved to Ann Arbor at the University of Michigan, where I did 7 years of surgical training. And then before I had to come into TCPR, I spent 2 years at Texas Children's Hospital in Houston, where I specialized further in pediatric surgery.
So why pediatric colorectal surgery?
So when I was a trainee, I was really heavily influenced by one of my mentors, Dr. Daniel Teitelbaum, who was really a giant in our field. And he really had this special connection with these patients of his that had these colorectal anomalies. And he formed these lifelong relationships with them. And he truly cared about them and cared about their families. And he would never rest until he was able to help his patients. And that really inspired me. And I really looked up to him. So I felt a natural kind of gravitation towards this specific specialty within pediatric surgery.
Interesting. And you've traveled a lot. You've been to Ethiopia, Egypt, Palestine, Sudan, and Peru for medical and surgical missions. Tell me a little bit more about those.
Yeah, when you go abroad to these places, you really realize how fortunate and privileged you are as a surgeon to be able to go out there and help patients and their families that aren't as privileged, and you see how far your help can go. We've had patients that would walk 10 hours to get to us so that we could fix their babies and restore, their normal kind of function, normal anatomy. And, without us, these patients often are outcasted because they don't, some of them don't even have colostomy bags. So they can't, go to school. They can't, have a normal social life because it's a social stigma. So when you go to these places and you do these simple operations, it can really be life-changing.
And what would you say is your most memorable experience?
Well, I would say, just seeing how you do a simple intervention and the outcome is so, powerful. And these parents, after these surgeries, they're just so grateful and so appreciative of what you're doing, and it really kind of helps you realize how privileged we are to be able to do this, and how wonderful this whole field is.
And what are you most looking forward to as you start your journey here at CCPR?
Well, I think we have put together here probably one of the most experienced and premier centers in colorectal surgery, I think, in the world, and I think we have the capability to treat the entire spectrum of colorectal disease, and I'm just excited to kind of see how we're going to continue to grow from here and even, treat more patients and really expand what we're doing.
Okay, awesome.
So
we're excited to have you.
Thanks. So Stephanie, first, so everybody knows, how do you say your last name? Because you have almost as difficult of a name as I do.
So it's Vorostek.
Okay.
Even though it doesn't really look like that at all. But it is my married name. My maiden name was a little less challenging. So it's something that I married into by choice.
So tell me, did you always know you wanted to be a pediatric nurse?
I actually started my nursing career as an adult in adult care, and I worked on a med-surg unit and then I worked on a pre- and post-op unit for about 6 years before I came to Children's Hospital to do pediatrics. So it wasn't my first choice as far as, positions, but I have grown to love it immensely. I think that just caring for someone and from such a small, tiny baby till, they get older, and even, some of our patients into adulthood it's wonderful. I love it.
Great. And tell us more about your role here on CCPR.
So currently I am the program manager for the center. I started here in 2014 as the neuromodulation coordinator. So I took care of all of the sacral nerve stimulator patients and all the gastric pacer patients initially. And then colorectal kind of put their arm around me and, pulled me in tight. And that's when I just developed this love for this colorectal population. And I think it was after my first bowel management week, there was a kid who was about 3 years old, 3 or 4, and we started him on rectal enemas, and he had never been clean before, and there's a lot of social stigma around that. And so seeing him through that week and seeing him come out on the other side of that week and to be clean, and he came in regular underwear, and he was so excited. And I think that was the thing that really, really hooked me, that we could really make a difference in a short amount of time for these kids. So.
Right. And any fun facts about you?
Well, fun facts. I have 3 crazy daughters, 7, 3, and about 16 months. And I grew up around horses, and I told the story yesterday about my first job was being a pooper scooper at the fair. And so, yeah. It's probably as exciting as it gets.
Well, thank you so much for sitting down with me and introducing me to folks. And I'm happy that we have you as a program manager. I think you're wonderful, and you're gonna help us grow even more and more.
Thank you so much, and we look forward to meeting you all when you come to clinic next.